The individual who passed away was a male in his 90s from Cass County who did have underlying health conditions. He acquired COVID-19 through community spread, meaning that the source of infection was unknown. Having lost both of my parents in my life, my dad when I was freshman in high school, my mom passed away in 2005. I know for this family how challenging that must be, but when someone, particularly a male, when a male lives to age 90, that means they were born before 1930. In North Dakota, the average age of a male lifespan is 76.8 years. So, Catherine and I extend our deepest condolences to this family and the friends. We also hope that they can find comfort in the celebration of a life well lived for someone who saw the span and arc of our country from World War II through today, part of that greatest generation. So with that, we extend our personal condolences, but it's a reminder to each of us that each of us has a responsibility to help prevent the spread. With community spread, we'll never know how this individual contracted the disease, but again, part of the efforts that we're taking as a state to slow down community spread and slow down the rate of infection is to protect our elderly and those individuals with underlying health conditions. We are absolutely all in this together, whether you are, whoever you are. Case count for today, North Dakota Health Department confirmed 10 additional cases of the novel coronavirus disease or COVID-19, 3 each from Cass and Morton counties and 2 each from Burleigh and Stark counties, bringing us to a total of 10 for the day. The good news is that that's down from yesterday. So some states get to that point where the curve starts going up and it just keeps going straight up. So positive news for North Dakota that maybe we bought ourselves another day here before we get to that inflection point, and also a point of a reminder that the sacrifice that people are making in terms of reducing their physical contact with others perhaps is making a difference. It's also good news that the 10 positives came out of a test count of 447 tests, so really pleased that our testing capability continues to show positive trends upwards. That's a record number of tests in one day. Of those, 16 have been hospitalized. And then on the chart that shows where these tests are coming from, we now have only 2 counties where there have been tests taken where the individual receiving the test has not indicated an address. That's Slope County and Billings County, indicated in the white on this chart, in southwestern North Dakota. 2 of our lowest population counties. But on the chart where we show where the positives are, again, there's still some confusion that the positives are, regardless of where you had the test taken, the county data that we show is what the address the person puts on as their home address. So if they lived in Western North Dakota, if they lived in Western North Dakota, an address in Western North Dakota, but were going to college in Fargo, took a test in Fargo, they would show up as a Western county. But again, as we've said, whether your county has positives or not, we should all presume that there are more positives than what we have reported. Again, we've got 68 cases now that have confirmed positive. A good metric for that, if you think about that a person may contract it and have no symptoms for several days, then they develop symptoms, then they go, hey, I'm sick enough that I think I ought to get tested. Then it takes a while to get the test back. When I'm talking every day about this being latent data, 10 positives might be picking up the positives from 10 days ago. We know that the spread, because each person who's been positive has an opportunity to infect 2 to 3 other people, is that it would be, when you multiply all that math, that's where you get the exponential. We should probably assume that the real case number in North Dakota could be as high as 10-fold higher than what we're showing in terms of positives. So the right way to act during this would be to assume that even if you quote, there's no positives in our county, that's why we have statewide mandates in place, is because we have to logically assume, given the lag in the reporting data, that this virus is everywhere in our state, and that everybody in the state has an opportunity to conduct that, conduct themselves appropriately to help slow the spread. In terms of the strategy related to this, we've talked a lot about the curve that is in terms of the two curves. One is this very steep curve, which is if you have a huge spike and then we overload our system. The other is the flatten the curve, which you've ever heard anyone talk about. We're doing that through all the actions that we're taking. There's another line on that chart, which we've now added an arrow on there to make sure that there's two things we're doing simultaneously, just so everybody in the state is on board on the strategy. With the work that we're doing to keep physical distance and practice the slowing of the spread, we flatten the curve. With all the work that the state is doing with the private sector, we're working to expand our hospital capacity. And where are we getting that hospital capacity from? As the number of elective surgeries go down, that frees up beds to take care of potential COVID patients. As we are exploring bringing facilities that may have been completely shut down or wings that have been closed off for capacity reasons to all of our 36 critical access hospitals around the state. All of those are actively under consideration as part of a statewide, state plus private sector planning process to try to expand the capacity that we have. And the critical capacity we need is actually the critical capacity, the essential capacity, is for critical care because we can have a substantial more success or a reduction in the morbidity if we've got qualified staff and the right equipment. That means personal protective equipment, it means ventilators, it means hospital beds, and it means the staff that can care for them. And so we're working on how can we expand the hospital system capacity to manage for this, expecting that peak will be 2 to 3 weeks or more out in front of us. And again, the further the peak is out, the better chance we have of staying underneath that line. And again, to remind people what it is that we're asking them to do, very simple, washing your hands, using hand sanitizer is one of the best ways. We know that this virus can be transferred and left on surfaces. So if you're touching an ATM machine, filling up with gas, touching a doorknob that goes into a place that the public might serve. There are different studies that are coming out now that showing the virus can live on a plastic or metal surface for hours. And so you may be someone may have gone through that door in the morning, you come in the afternoon, you touch that door, you may have picked up the virus completely unknowingly. And then you could carry it to someone else and you could give it to yourself. Again, we talk about not touching our faces. There are lots of studies that have been out that show how many times a day all of us touch your face. It's a very hard thing to even be aware that you're doing it, but when you touch your face, you have an opportunity either to, if you're carrying it, you have an opportunity to transmit it to a surface someone else. If you picked it up from a doorknob or another surface, you could get it, including rubbing your eyes, touching your nose, your mouth, etc. So again, this is what we're talking about. The basic hygiene and keeping physical distance is the way to slow the spread. So thank you all for doing that. Another big thing I want to highlight, apparently the only thing that travels faster than the virus in North Dakota is misinformation. We have been, in our office, been bombarded in the last 2 hours with rumors that somehow today at 4 o'clock we were going to announce that we were, quote, shutting down the state, we were locking it down, we're going to close the borders. I want to reassure North Dakotans that this is not the plan, and it's not even possible. For North Dakota to function, even during a time of a pandemic, for example, shutting our borders, I mean, all the food you buy in those grocery stores that those people are working so hard to restock every night, all that food is coming from another state. I mean, there's very few items in our hardware stores, in our grocery stores, medical supplies, all coming from out of state. Shutting the borders is a nonsensical, non-effective, non-approach, which is why, again, in this week, I've been in been in direct contact with the governors of South Dakota, Montana, Minnesota, and the premiers of Saskatchewan and Manitoba, because what we do affects our neighbors, and what our neighbors do affects us, because we're all part of one economic system. We're all part of one system where people do. And the reality is, in the U.S., we don't have the tools that a country like China would have. We're a country of liberty. We're a country of freedom. We don't have the same tools that another country might do that. But with freedom and with liberty comes individual responsibility. And so in our state, as we've asked people to try to follow these guidelines, we're appealing to that liberty which we all cherish. You know, again, this is a time to exercise, not demonstrate your freedom. It's a chance to demonstrate that you're a responsible citizen of a free country, and that you'll make the choices that help protect the over 20% of the people in our state that are at risk, including those over age 65 and those with underlying conditions. So again, we're providing some changes today to some of our guidance related to specific businesses, which I'll be announcing shortly, but we are not doing the so-called lockdown or closing the borders, which people have talked about. And if you look under the covers, a number of states have got things labeled shelter in place. Those shelter in place orders, if you look underneath them, in many cases do not carry the force of law, and they have a long list of exceptions. And so it's one strategy. Each governor gets to choose their strategy. In North Dakota, we're banking on the North Dakotans understand what individual responsibility is, and they respond to that more than they might respond to a government mandate. And so again, asking people to do, because it's not even really about restricting travel. It's about restricting being in a position to transmit this to someone else. And the way you avoid that is all the rules we've talked about. And certainly when we think about, you know, what's going on right now, ranchers that are delivering calves and farmers that got to get ready for spring planting, and school kids that are going to be going back online next Wednesday, and healthcare that needs to carry on, and food that needs to you know, be delivered. We just have to keep doing what we can do to keep ourselves moving forward, but doing it in the safest possible way. And I'm betting on North Dakota that that's going to work. We also, again, strongly recommending returning residents, college students or snowbirds. Talked about this the last couple of sessions. If you've come back from spring break and you're back in North Dakota, if you're a snowbird returning to North Dakota this spring, you know, or if you haven't come back yet, when you do come back, you will be expected to fill out the travel survey online on the North Dakota health.nd.gov website. You'll receive information about what symptoms to watch for, how to self-isolate, and so on. And we are requesting that people traveling into our state that are coming from those hotspots will self-isolate for 14 days. We have two executive orders today. The first one relates to personal service businesses. The past couple of days, we have crossed a threshold in North Dakota for the first time. The number of COVID-19 cases in the state are attributed more to community spread than they were related to travel-related or people that had close contact with someone who was travel-related. We've also been seeking and receiving a tremendous amount of input from business owners and technicians in the personal care sector, as well as the general public, asking us to take the step to close the businesses for the health and safety of the workers and the customers in the personal care business. So with these factors in mind, and to further prevent and slow the spread of COVID-19 in our state, I have signed an amended executive order. And the original executive order had to do with the bar and restaurant and other, you know, gym closings. It's been amended and signed in the last half hour, directing the closure of all businesses that are operated by licensed cosmetologists. That includes manicurists, estheticians. It also covers massage therapy, barbershops, tattoo, and body art facilities. This executive order is effective as of 12 a.m. tonight. Or I guess 12 a.m. is technically Saturday morning, but midnight tonight is the way to think about it. So they will be closed this weekend. I imagine this will create a mad rush to get a haircut tonight, so you can note, instead of having a bad hair day, you might have a bad hair weeks coming up. But again, please exercise judgment tonight. And again, we're doing this with this strong support from this industry, being in contact with their licensing boards. Some of them had already made a decision to close out of the safety for their employees and their customers. Others had not. So again, some of these decisions come down to a matter of fairness and equity. So strong requests for us to move this. And again, we appreciate those business owners that had already taken steps to protect their workers and customers. And we appreciate the compliance of others that are following this. We have this order also clarifies that local, county, and state law enforcement are authorized and directed to enforce the provisions of the executive order. The violations of these orders, whether it's bars, restaurants, or personal service businesses, it's an infraction and subject up to a $1,000 fine, and that's managed again by local, county, or state law enforcement. Who does this affect? In North Dakota, we're fortunate that we've got great personal care services in our state. Over 8,500 individuals are licensed to provide personal care services in our state. That includes 939 salon and what's called over 1,000 what are called booth licenses, where someone who's a individual proprietor may rent a chair, if you will, inside of a salon. We recognize there's a significant number of people affected by this, including business owners, independent contractors, employees, and everyday citizens who receive these services. But again, we're trying to strike that balance about slowing the spread of COVID-19 by flattening the curve and ensuring our healthcare isn't overloaded, but also making sure that our economy can still function and recover when it's over. We're on the back end of the spread of this within the United States, meaning, as you know from the numbers from New York and others, it's continuing to explode in places like that. But we now join 39 other states who had already restricted personal care statewide. Okay. Next up is the second executive order. Last week, we signed an executive order to cut red tape so that people would have an easier time filing claims for unemployment benefits during these extraordinary circumstances. And that pertained not only to employees that were impacted by some of our executive order closures, gyms, movie theaters, bars, et cetera, but it applied, that red tape cutting applied to any employee who was affected by COVID-19 economic conditions. And so we've done a lot of things, and we've announced a lot of what we're doing for the employees. But today, we want to do some things for the employers, because we know that employers are struggling just like employees. And when it's over, we need those employers to be able to get back on their feet, provide jobs, and help our communities and get the economy rolling again. We've got two state agencies that are directly involved with virtually every business in the state. One is Job Service North Dakota, which handles the unemployment aspect. The other is our state's very own workers' compensation agency. In some states, workers' comp is provided by the private sector through multiple individuals. Here in North Dakota, by law, there's one provider, Workforce Safety Insurance. They provide it for everybody in the state, and they do it at rates lower than virtually every other state in the nation. And they also do it in a way where we're able to provide premiums, reductions in premium dividends back to those employers, and we've got a over $2 billion workforce safety sort of health insurance trust fund that helps fund all this. And so we've got one of the healthiest workforce safety setups in the country going into this. But one of the things that's required, if you're an employer, you have to file quarterly reports, and you've got to make quarterly payments. And if employers are late in filing those documents or they miss a payment, the law requires us to currently to assess interest on them. With the current environment and through this executive order, I signed an executive order today that gives North Dakota employers a ability to suspend the payment of their unemployment taxes, and also this will effectively suspend any interest because the suspension of these then won't be treated as late payments. For job service, this has to do, this executive order related to suspending the payment of unemployment taxes and filing of payroll reports that are due on March 31st, this coming Tuesday, for the first quarter of 2020. So the deadline next March 31st, people would have been, all businesses, over 26,500 businesses in North Dakota would have been trying to file by March 31. Don't have to do that. There's about $30 million that would have been coming into the state of North Dakota as part of that payment. That's deferred. It's still owed, but it's not paid until later. And so that gives those employers an opportunity to keep that $30 million in their own accounts, and that will help them as they're taking care of their employees and their customers during this crisis. So again, employers are able to retain those contributions for critical and immediate needs. Reports and payments that will still be accepted if some employer says, hey, I want to go ahead and I want to file on March 31st and I want to pay on time. You're welcome to do that. All employers, there's no requirement. Every employer in the state, all 26,500 job service North Dakota businesses that have account holders have the option of utilizing this extension. More details are going to be available for both of those on jobsnd.com, workforcesafety.com. Next topic is I may have been signed as I was walking up here. I know it was signed. So the President has just signed the CARES Act, which is the Coronavirus Aid, Relief, and Economic Security Act. It's been completely overused when you're in a period where things are happening that have never happened before, the word unprecedented, but safe to say this is without precedent. $2.2 trillion of economic impact, and there's bills that are in here that small businesses are now going to be able to apply for bridge loans that are forgivable. Okay, so if you're a small business, you could get a loan, and the requirement is as long as you keep your employees and pay your employees, and coming out the back end, you got the same number of employees you had going in the front end, you could have a forgivable loan. A forgivable loan is like a grant, additional grant funding, grants and for technical assistance. It's also got the part for individuals. You've heard it talked about in the press. It's now been signed into law. $1,200 tax rebates to the individual, so there'd be two for joint filers, additional 500 payments per qualifying child, and that's based off your income levels for 2018. It expands, includes a dramatic expansion of unemployment insurance benefits, aid for hospitals, billions and billions in aid for hospital, and billions in business loans. The federal legislation also provides for temporary suspending payments for federal student loans, extends the tax filing deadline we talked about, and then there's also specific critical industry loan guarantees. Funds and programs will be administered by numerous federal agencies. We are, of course, digging in right away to try to understand what this all means. If there are cases where some of these payments may be stretched out and aren't received in North Dakota for 90 days, that's where we as the state and the Bank of North Dakota could step in and create loan programs to loan money to North Dakota businesses until they get their federal payments and close that gap. But we'll take a look at that as we dig in tonight and over the weekend on the actual effects of that. Yesterday we had a question about the fishing opener, and the answer coming back from Game and Fish, who's evaluated what's going on in other areas around, in other states around us. There have been no hunting or fishing seasons that have been canceled in any of the states. We're driving our own ship on that right now and making our own decisions, but that's just for a comparison. April 1st is when the non-resident fishing season begins, and I know people are concerned about the role that travel may come with people that are coming from out of state, but at this point we're not considering closing the fishing season or suspending any non-resident licenses. And whether you're resident or non-resident, again, we're going to be posting signs. Game and Fish will be monitoring over the opening of that season and opening weekend what might be considered, potential crowded areas, putting up signage to remind people to adhere to the proper distancing recommendations. And if we see that there is problem areas, then we can close those specific areas. We have over 400 lakes that operate as fisheries. It is certainly possible in the state of North Dakota to go fishing and stay more than 6 feet away from somebody else. But if we've got some hot spots, then we'll try it again. The key here is to not shut down all outdoor activity or activity that would allow proper distancing. It's to make sure that we're here. So if you're at the boat ramp or going there this weekend, again, please take our recommendations seriously. And Game and Fish and game wardens, licensed law enforcement that they are, will be also monitoring this as part of their work. The unemployment count, we get asked about that every day. Today through 3 p.m., thankfully has slowed down a little bit here on a Friday, but we had 1,178 claims through 3 p.m. today, bringing the total to 16,677 for the last since the thing started shooting up a week ago Wednesday, or in 9 days. And in closing, before questions, wanted to again, we've talked a lot about gratitude at each one of these, but gratitude's not a platitude. Gratitude is actually a real tool, and it's a tool that can help reduce stress. It's a tool that can reduce stress for yourself, for your family, at work, and acknowledging the role that this can play in our behavioral health. Our North Dakota Behavioral Health Team has put a tool set up. You can find that at behavioralhealth.nd.gov, and you can also reach that through ND response.gov. Those websites, there'll be a link there to do that, but I would encourage people, as you're thinking about the situation that we're in, that we still as Americans and as North Dakotans have so much to be grateful for. And I'll throw one thing in today that we can be grateful for in North Dakota, and that's clean air. When we take a look at some of the areas where the death toll has been higher, like northern Italy. This is one of the worst air quality areas in Europe. Northern Milan, they've got some geography there up against the Italian Alps that traps bad air in a region in there. China is notoriously bad air quality if anybody's ever traveled there. These things contribute to those underlying respiratory causes, and one thing that we can be thankful for in North Dakota is that we have among the cleanest air in the nation here. But one way to keep the air in your lungs even clearer is reminding people again, great time. 1-800-QUIT-NOW. If you're smoking, great time to quit smoking. If you're vaping or haven't vaped, don't start. Putting stuff in your lungs that doesn't belong there, always a bad idea. Take advantage of that North Dakota clean air. Stay healthy. With that, we'll move to questions. We're going to start over here with Jack Dura.
Have there been any cases identified in a nursing home, and if so, where?
Question is, have there been any cases identified in a nursing home, and if so, where? And as part of the positive case information that we have relative to what we receive at the state, which is age range, gender, and county of their home address, that's what we're getting at the state. It would be up to a individual nursing home, which we know from the guidelines that we've talked about. If they have a case, that nursing home would make that announcement, because they'd want to be alerting all of their residents and all their residents' families and their staff if they had an outbreak. So that's where we'll all first hear about it, is from the industry. Dave Thompson.
To follow on your last comment about Quit Now, have you seen a spike in people calling the 1-800-QUIT-NOW line?
Question was, have we seen a spike in people calling 1-800-QUIT-NOW? I don't have the answer to that, but I love your curiosity, Dave, and I'm going to go check on that. I hope the number is up. There are lots of other places where we've seen increases. And again, on the whole behavioral health thing, I mean, one thing which I know that other states have seen, I hope we don't see it here, but there has been, with the sheltered home, stay at home, there has been an increase in calls related to domestic violence. And again, I hope that that's not the case in North Dakota, because this is a time for us to dig in and find our patience and our kindness as opposed to amplify our frustrations. And so another reason to get outside and avoid that cabin fever. But we'll check on the smoking. I would say the reason why I'm bringing up vaping is that if we take a look at the numbers for the nationally and for the state of North Dakota, we had made steady progress for 30 years on dropping the number of people that were involved in smoking, and specifically teenage smoking. We had dropped it down, and got it down lowest it had been in 30 years. If you take smoking plus vaping, it's back up to where smoking was in the 1990s. So that's a coming huge health crisis, and we know that, before the coronavirus, there was in the news about there was deaths related to respiratory diseases attributed back to vaping, and people may be doing modified vaping of whatever they're vaping. But again, I think this would be a really good time to not be vaping when the coronavirus is floating around. I'm going to Jacob.
Governor, do you know if the money from the CARE Act will be taxed?
Will money from the CARE Act be taxed? Given this legislation is about 20 minutes old, I don't know the answer to that, but I'm sure somebody thought about that, and maybe before we're done here, someone in the audience will have the answer for me if they know that. I would think that I believe the way the language is around the $1,200 per person is a tax rebate. So if it's a tax rebate, that part would not be taxed. If it's a forgivable loan, I doubt that would be taxed. But I think to say that they've applied that across all 2.2 trillion, that would be a stretch for me to think. But I would guess that many of that they've already thought through. They're not trying to send it out so they can collect it back. Again, I'm skipping over you back to Jack Dura, Bismarck Tribune.
What date did the Cass County man in his 90s die?
What day? We were informed of it this morning. And so I'm going to make a presumption that it was today or early today, because we found out I think we put a press release out mid to late morning after we'd been notified. But again, we want to inform the public as quick as we can, but of course we do not want to be ahead of any family notification. So the procedure that we're operating under, unfortunately, if we have more deaths, the procedure will be that the medical facility or hospice or whatever organization will make sure the family's notified before we make any public announcements. But we'll continue to include those updates in our daily numbers.
An update from the question yesterday on possibly expanding protection for renters. You said something was in the works. Is there an update on it?
No update today on expanding protection for renters, but I do know, again, I would refer back, and we can follow up afterwards, but the action that we took at the North Dakota Industrial Commission meeting on Monday, which included North Dakota Housing Finance, any facility in North Dakota that receives HUD funding, which, the Federal Housing and Urban Development Agency, falls under those federal rules. And so we're following those guidelines. That's about 3,000 units, and people might think of them generically as low-income housing, but in those cases, the no eviction rules and all the stuff that HUD is doing nationally, then we're following. And the Bank of North Dakota, which has a portfolio of mortgages, is also following that same guidelines, and we can follow up with that information, but that was all done earlier in the week. Lane? KX News?
Has there been any, excuse me, has there been any numbers given to the state to give an estimate on how many essential employees in North Dakota are still going to work?
If people could, thanks for talking up, if you can hear that question. Are there any numbers on number of essential employees? I've not seen any numbers that get down. Are you talking about state employees? Or are you talking about in the whole state? In the whole state? Yeah, depending on your definition of the type of work, and again, it can be pretty broad, because I think all of us, when we go to the light switch, we want electricity, to happen. When we go to the water, when you turn on the water, you want water to come out. So we're talking about sewer, water, electrical, all the infrastructure. We're talking about everybody in medical, first responders. We're talking about most of government services. I mean, if you're during this time period, we've got to make sure that people that are working in banking and finance are still working. We have to have the things that help people get through this crisis. And so you can get up to large numbers of the I think you'd easily get from a third to a half of the people that might be, considered under even some of the other states that have shelter in place, except for essential. That could be half their economy is still working. Would vary again by the definitions. Each state's got a little bit different definition of what their exceptions are to that rule, but they're quite broad because everybody's got to keep the lights on and keep keep elements of our economy moving. I think we have a question coming in from online, and Danny, speak up loud so they can hear you in the microphone here.
April Baumgarten with the Forum in Fargo. Can you share what day the man from Cass County passed away, and can you share if that was in a hospital or a long-term care facility?
The first question was, can we share what day the individual in Cass County passed away? We've already shared that, which is we believe that was today, early this morning, and then we're not sharing whether it was hospital or long-term care facility. That's up to the facilities themselves. Again, we'll be doing gender, age, and county, which they've got registered as their address. Still a radio legend, Dave Thompson. Legend's growing. Another day in the life of the legend.
Well, I've had a number of calls from people who asked me to ask you this question. They're getting frustrated because they can't see their elderly parents who are in nursing homes. They were wondering if you are considering maybe relaxing the rules for visitation for nursing homes.
Given that Dave's a legend but soft-spoken, I'll repeat some of that to make sure, is are we considering relaxing any rules related to hospital visitation, people wanting to see their loved ones? Answer is no. I mean, we are, the best way we can do to protect the people that are in those 218 facilities in North Dakota, 80 skilled care, and then the rest either assisted living or lower stage of care, is to make sure that the virus doesn't get in. And so that's right now we've been able to avoid what the state of Washington and other states have had, where they've had nursing home outbreaks which have led to multiple fatalities. We've been able to avoid that. We'd like to continue down that. We understand that's hard, but again, encourage people, if you haven't given a device where you can FaceTime or Skype with your loved one, figure out a way to get that device into those facilities. And I know that our great long-term care staff around the state of North Dakota that are working hard on the front line are working to provide those kinds of accommodations to keep people to stay in touch more than just by phone. Okay.
Rebates would not be counted as taxable income for recipients, as the rebate is a credit against tax liability and is refundable for taxpayers with no tax liability to offset.
Okay, so if people heard that, my prior answer was correct, and with the addition of, if you did not pay taxes in 2018, which is the year that this is based off of, then it would show up as a credit on your future taxes, or you'd get a rebate, if you will. Maybe you get a check, then, like a tax refund.
If you filed for 19 already, it'll be based on 19.
Okay, if you've already filed for 19. I'd like to meet those people, whatever, the ones that hadn't heard that the date's been moved to July 15th. But if you did, it can be right. We have one in the room who's already filed. Amazing. Okay, thank you for helping North Dakota and the U.S. keep running. Question back to Jack Dura.
Correct me if I'm wrong, Governor, but did you say we're potentially 3 to 4 weeks out from the peak of this virus in North Dakota?
Yeah, Jack, early filer Dura, is wondering if we are 3 or 4 weeks out from the peak. Again, these are models. I mean, we can do modeling of when we think the peak is coming, and we know that we're still growing. We know the number of active cases continues to grow. We know that we have latent data, and so that's our best guess. But I've likened this to flood forecasting. You can have a flood forecast that says it's going to flood on X date. Well, then as you have another week of weather, and another week of precipitation, and the weather's cold, the weather's warm, you have different melt, you have different soil saturation levels, then you revise the forecast, and we'll be continuing to revise that forecast of when we think the peak is coming. And it's very, very difficult, because guess what the peak depends on? I mean, the flood forecasting depends almost entirely on Mother Nature and a little bit of history. forecasting a virus depends on human activity, which is impossible to forecast because we don't know how much any particular mandate or order or suggestion actually reduces the amount of contact that people have in a given day with other people. We don't know that, and so it becomes very difficult to forecast the rate of spread of the infection and how much we're flattening the curve. So that becomes almost impossible. So the best we can do is, again, as we say, plan for the worst, and keep aspiring for everybody else to help us create the best, because it's not hoping for the best, it's actually taking action to achieve the best. The best is a flattened curve and making sure that we've got enough healthcare capacity to get through this. Lane?
Kind of a two-part question in reference to the executive order about closing down nail salons and hair salons and such. Is there a timeline for that, or is that until further notice?
Great question from Lane at KX News here in Bismarck. The timeline of when is the order related to personal care services extend to? The order, because it was included in the amended order related to bars and restaurant, that goes through April 6th, I think was the date. And then when we put that one out there, as we get closer to the April 6th date, we'll be evaluating where we are relative to the peak of the spread, and then we'll be deciding, do we reopen? Do we, partially reopen or reopen some and not, what do we do? That'll be a decision that gets made down the road. That decision will be upon us, probably in a week, on whether or not we have to do extensions to that order on closures.
And the second part of that question is, why did you choose in about 8 hours instead of like Monday morning?
Question was, why did we choose to close tonight at midnight versus Monday morning? Given that we've sort of had this tipping point, at least in the latent data, that we're already more into community spread than travel spread, and knowing the weekend, if you said, hey, we're closing on Monday, we could have actually created a lot of crowding at those facilities this weekend, because, I'm like everybody else. I get up, I look in the mirror, and I go, man, maybe I should get a haircut one last time here. So it's we could have created a thing that could have, again, created safety issues, particularly for, not just for customers, but for the workers. A customer might go, hey, I'm only going to be exposed to one person for 1 hour during a service. The person that's delivering that service might be exposed to a dozen people during the day. So again, that's why the industry, the associations, the license boards, we're all encouraging for us to do this. Do it now. We make the announcement, make it quick, and again, we realize that not being open tomorrow, there's probably people that had appointments tomorrow. I'm sure they did. That's going to create, some challenges for people. But again, we just ask for everybody's patience and understanding that they're, by participating in this, another 8,500 individuals that we're protecting that are in that personal care delivery side of North Dakota, that we're also, tomorrow we might be stopping 100,000 contacts between those care individuals and 10 customers. If you stop that kind of contact tomorrow, that's going to help us push that curve out down the road. It's a math game. Again, a question from online, nice and loud.
Tom Simon with Trending Topics in Williston. Does North Dakota's first death change our tactics in responding to COVID-19?
From Tom up in Williston, who was here in person yesterday, does the first death change any of our planning? And the answer to that is really no. We've known that this is a deadly virus. We've hope, you hope, like I said, hope this day would never come. There's only a few states left in the U.S. that haven't reported deaths. I'm sure by the time this is over, that every state will have at least some deaths related to COVID-19. And I guess we can celebrate that that it took this long, because we're trailing other places, giving us more time to prepare. But we're still on the same track, same planning that we've always had.
Question more for Milo Tufty in reference to the DOH graphic that shows how many positive cases there are. There's now the deaths bubble and there's the recovered bubble. It says there are 68 positive cases. Are those 68 active positive cases, or are they 53 positive taking the recovered number?
Mylene, you want to come up and answer that? as we work to clarify the data on our charts.
So the 68 is 68 individuals in North Dakota that have tested positive, and then the recovered number is the number of individuals that we're no longer monitoring that have passed through their positive symptoms and illness, and I think that should cover that.
So there are 53 people with coronavirus in North Dakota right now then?
If you did the math, yes.
I would just clarify for Jacob, 53 that took a test, we think the number could be 10 times that size of people because, again, the amount of testing we've been doing, even though we're doing well on a per capita basis, other states, as a nation, we are behind where we would like to be or what would be best practice in terms of testing. And so you have to assume there's, and again, the latency, we're testing people that may have got infected 10 days ago, and we're reporting to you today that they're a positive. And so again, we know that the number of cases is larger than the number on the chart. And we know that the number will grow because it's until we get to the point where it's flattening the curve, and there's not any state in the nation where the curve is going down yet. As a nation, we're still going up, and our curve is going to be coming behind others' curves, but ours has got a ways to go yet. Danny, again online.
Dave Kolpak with the AP in Fargo. Any idea where the shelter-in-place rumors came from?
Dave Kolpak from Fargo. Any rumors about where the shelter-in-place came from? I'm sure there's patient zero out there someplace. I mean, that's when people do the epidemiology. Who's the very first person that had the case? We can't trace where this rumor started from. We know that earlier today there was Facebook postings that were going that said at 4 o'clock the governor's going to do this, at 4 o'clock he's going to say that. We also know that there was some elected officials that may have called people and said that as well. And I guess as I'm appealing to all North Dakotans, I would appeal to anyone who's an elected official or who's in a position of responsibility to call our office or look to the trusted websites we have and not to social media for what's going on. Because if every citizen's got the ability to call the governor's office, elected officials we talk to all day long. And so again, we just, because part of where it got some momentum was, oh, we heard it from here, we heard it from there, it must be official, they must know. But that's the anatomy of a rumor. And rumors have been around since mankind traveled the earth. They just now go a lot faster when you got social media and when you have a lot of people that are spending a lot of time on social media because of the current environment we're in. It's just extra important that people really make sure their sources are good, and part of that individual responsibility for people is to stop those things if they're not true, as opposed, because people get nervous. That's when people start running out to cleaning out the stores on the shelf because they're worried about some impending thing. And we're putting a lot of energy to communicate directly with the citizens of North Dakota, authentically, openly, regularly, and honestly, to try to stop exactly the kind of thing that was going on this afternoon. And that's why we'll be back here again tomorrow at 4 o'clock. Another one online? Coming in. And thank you, Dave, for that question from Fargo.
Mike Smith with KEYZ in Williston. Is there any update on the tests from Stanford that were sent to the private lab?
I did not get a report this afternoon, and so I don't know how many. I know that there are still pending, but I know the number is going down because they're getting tests back from Quest every day, but we still have a number of pending in the state. But I think you saw on the chart the number of tests completed are in Cass County is now catching up to Burley. Those are the two counties where, again, two larger population counties, Cass being the largest population county. As those pendings come in, we'll continue to see the number of tests in Cass County keep growing to being the most, to reflect, as it should, the highest percentage of population. Okay, are we any more questions coming in? If not, again, I'll just close out with a big thank you to everybody that's been listening in, and thanks for your action. Thanks for your understanding. Thanks to all the school leaders that are working on their plans. We've had lots and lots of those plans that have come in. First batch, I think, was getting approved this morning. Others are getting recirculated for more input from the school districts, but we have a lot of momentum towards bringing K-12 back up on distance learning next Wednesday. I know there's been a lot of work going on that front, so thanks to everybody in the education community, and thanks to all the people that are working diligently around the clock to try to expand our healthcare capacity, and thanks to you, our citizens, for doing your part with your individual responsibility to save lives. And with that, we'll maybe give another shout out to all the state employees. We did have our first virtual town hall meeting, so we used some of the technology tools that the state of North Dakota has. We had over 3,000 connections today. We had about a dozen cabinet level leaders and myself that were online today, communicating directly with the team members of Team ND across the state. Had a lot of great questions, but they're doing a lot of fantastic work, and it's a kudos, shout out to our NDIT team that has helped move 7,100 people in 48 hours to working from home. So that's a great stuff. And nobody, I mean, I shouldn't say nobody, but I did want to give an update if I didn't at the beginning. Brent Sanford, who's still alive and well and working hard, not here today at the press conference today, but he's been spending the entire day working on another thing which is facing our state, which is the energy crisis that we're facing. WTI price of oil, $21.60 at the end of the day today. These are going to create some challenging times for industry and for the communities in the oil patch. And one of the things we got to do is, get through this health crisis so we can get the economy back on track. But thanks to Brent for everything he's doing on as leader of the Empower Commission. That means he's working not just on, oil, coal, wind, working across all those industry segments to make sure that we keep doing our job here in North Dakota, which is power the world and feed the world. That's what we do in North Dakota, and we want to keep doing that like we were before this crisis. So thanks to Brent also. With that, we'll see you guys tomorrow at 4. It'll be an abbreviated conference tomorrow, but I'll be here taking Q&A. We'll give you the case update numbers, and then I'll be available if you got questions. And thank you.